Hi, I'm Hilary Beckwith. My pronouns are she, her, and I'm here to talk to you a little bit about why I'm here. And why I'm here is based on why you're here. So let's start with that. Based on my experience, I am guessing that you are here because you've seen all the providers, you've been told everything's fine, you've tried all the diets, you've tried the workout routines, and you are still having symptoms and you cannot figure out what is underlying all of these. My friends, I am here to help you. I was in the same boat. You are not alone. For many years, I will tell you, I felt very broken. I felt very dismissed by providers I was seeing, very confused, very much in the dark. I was diagnosed at one point with PCOS, which is polycystic ovarian syndrome. I had hypoglycemic tendencies. I had very painful cystic acne, in addition to things like migraines and just a whole slew of these health issues that really made me feel, um, like I said, like I was broken, like something was wrong with me. I would go to these doctors and we would try medications, and those medications might help for some time, but I realized that once I stopped taking the medications or once I stopped doing the therapy that they had prescribed, the symptoms would resume again. And that was really telling to me that something was happening underneath it all. Something underlying was going that we were missing the mark. Nobody was really willing to look into it, and quite frankly, not to their own fault, but allopathic doctors are not trained to look into it. What they're trained to do is to look at the numbers and to change the numbers, and that's exactly what they were doing. Um, why I am here and why holistic providers like myself, functional providers like myself, do the work that they do is to help you get to the root cause of your symptoms so that we can make more effective changes without having to always use medications or therapies to just simply change the numbers. Yes, sometimes that's necessary. But really what our aim is to get at the root cause of your symptoms so that you can make more effective changes. Now, what this helps us to do is to grow intuition, is to educate you. How do your symptoms connect to what your body specifically needs? We call that bioindividuality. What you need is different than what I need. And so that's why one diet doesn't work for everybody across the board. That's why one workout routine doesn't work for everybody across the board. That's why looking at the root causes is really important, because everybody has had a different experience with food, with digestion, with immune health. And so, what I'm here to do is to help you figure that out. What are my credentials? I am an NTP. I have about 20 years experience in physical medicine, which is actually kind of what inspired me to do this, where we talked a lot about inflammation and nutritional components of inflammation. I was counseling patients, helping them to reduce their inflammation while they were undergoing a physical medicine treatment plan. And between that and my own health issues, it really inspired me to do this for other people. And so I started my own private practice in 2021. I became certified as a nutritional therapy practitioner, or NTP, as well as got board certified in holistic nutrition. So I'm really here to take a whole person approach. I can work with your other providers even if we need to, especially if you're on any kind of medications. We can work with your other providers to just make shit happen for you. I'm here to advocate for you and to teach you to advocate for yourself. So my Reclaim Your Health program, that's really why you're here. So that's really where the magic of nutritional therapy happens. I designed this program because of the experience that I had and because of what I'm finding my clients need me for. What they really need is an experience where where we can assess what their health needs are, and then work together consistently to address those needs from an underlying root cause standpoint, so that becomes more effective long term. We're not putting you on a pill and then having you come off it and everything resumes. We're making real changes that matter 10 years down the road, 20 years down the road. We're growing that intuition in you, helping you change your relationship with food, with how you live. It's quite frankly, it's the only way to go, getting down to those root causes. There's even evidence that shows that simply educating patients on what is actually happening in their body shows significant improvement in pain cases. So I think that's really fascinating that education is such a big component of it. Um, so that's what I want to do for you. How do you get started? It's super easy. You book a free intro call. I call it a wellness strategy session. It's a free 30-minute video call, so you don't even have to leave your house. And that's how we get started, because it helps us determine what your health goals are and whether or not you're even a candidate for nutritional therapy. Sometimes I end up referring people out to other types of providers because maybe it doesn't sound like that's what they need in order to meet their goals. So we'll talk about it. There's no strings attached. You just book that free consultation and we'll chat it out. So I'm glad you stopped by today, because that tells me that you are ready for change and you're ready for something real. And I'm here to help you do that. So click the link to book your free wellness strategy session, and I will be seeing you around.